This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. Indeed, I'm live, and it's another lovely day in the neighborhood. Make sure that we get a chance to enjoy it. Go outside, go for a walk, have some fun. But if you do it while the program's still on, make sure you put a headbuds on and listen to me, because I've got a lot of stuff to share with you today, probably much more than we have time for, but we're going to try to condense it. But nevertheless, we're here to serve, right? To serve, educate, and empower you, because you're the ones that need it. You have to have the data and the information to move on. That's why we do Dr. Tom Roselle Live. Seriously, though, I've got some really good data for you today. We're going to talk about things that go bump in the night. And when I'm talking about things that go bump in the night, I'm talking about things that disrupt your sleep. Many dentists will call it sleep apnea. And there's a lot of things that go along with that. In the second part of the program, we're going to cover what happens with neck and back pain, and actually spinal pain that's chronic when you have an ongoing blood sugar handling problem, and that's called diabetes 2 or pre-diabetic patterns, or even transient blood sugar handling problems, what happens when you go into a hypoglycemic reaction, meaning going up and down the scale, back and forth. And guess what? If you do that, you have a much greater risk of having spinal and structural pain that will never go away. And that's one of the reasons that when you're at our office, we're looking at your dietary patterns, and we're looking at your blood sugars and your body chemistries and adrenal fight, flight, and all those things. But, and then as we get to the middle of the program, we're going to have a little bit of a COVID corner, because there's some things I want to talk to you about and make sure that you are aware of some of the things that are out there right now. And just, FYI, make sure you know what's going on. So that's what I do. That's, draw your attention to the things that you need to have. Having said that, let's talk about things that can cause you some really interesting presentations. How about your spouse? You're laying there at nighttime and he or she grabs the pillow and smacks you, right? And because you sound like a locomotive and your breathing is interrupted and you stop loudly, right? So, and then your snoring is like unbelievable. You couldn't even audition for anything that is symphonic. You're tired all the time. Daytime, you can't get your head around anything. You wake up in the morning and your mouth feels like you have, an army that's walked through it, or you have a sore throat when you wake up in the morning. You wake up choking or gasping, so all of a sudden you go like that, something of that nature. Or you're suffering from insomnia. You never get into a deep sleep. You wake up in the morning, you got a headache. You can't concentrate at work or even reading a book. Your memory begins to break down. You're putting on weight. And then, oh my God, God forbid, you've lost your sex drive. It's just gone. It's not there anymore. Well, every one of those symptoms, every one of them, has to do with sleep apnea conditions. And unfortunately, over time, it can affect many other body systems as well. And it's not okay, because your heart can be affected. Blood sugar transports can be affected. That's where the weight gain comes from. So kind of we're tending into the second part of the program, right? But sleep apnea, by definition, is a sleep disorder. It results in repeated and brief interruptions in your breathing throughout the night. And they say, well, it'll kill you. You've all seen the ads. Well, in its worst state, it can cause some very significant problem. Now, there are different types of sleep apnea, and this is what I want you to know about. There's something called obstructive sleep apnea, and it's the most common form. And it's caused by a blockage in your airway. I mean, your breathing tube, okay? Your trachea, or further up into the nasal membranes and so forth, in the back of your throat. Something of that nature is causing you not to be able to breathe. And it occurs when your throat muscles relax and the softness, the soft tissue in the back of your throat collapses on your airway. So you can't get anything in there. It's an obstruction. So it deprives your heart and your brain from oxygen. And what happens is your blood pressure increases and your heart rate also increases. So in this type of obstructive pattern, you do run a risk of dramatically putting stress on your heart and on, the different vital organs because of the increase in blood pressure. So your brain then must arouse you from sleep and restore proper breathing. That's where the gasping comes in, and all of a sudden this major tone is there. So we've got all kinds of potential problems. The next piece, so we talked about obstructive. The next piece is called central sleep apnea. It's less common. But this one is caused by a malfunction in the central nervous system, and where there's a failure of a brain and the nerves to relay the proper signals to the proper muscles for you to breathe properly. So this is one that we see, even though they say it's less common, we see it very commonly. And where it comes from is the vagus nerve, the hypoglossus, and the glossopharyngeal nerve. All three of those nerves are brain nerves. They're cranial nerves. And they go to different targets within the body. And this vagus nerve, which you've heard me talk about ad nauseum over a lot of different things, but that, oh boy, that's the wanderer. That goes from your brain all the way down to your lungs and your heart and your stomach and your bladder and your kidneys and so forth and so on. But it's right at the brain. So if you've ever had an injury, if you've ever hurt your neck, if you've ever had a car accident, if you've ever had a fall, or you see that there's some deterioration going on, often because of the misalignment of the spinal system sitting underneath that big old head of yours, that skull of yours, that nerve, that vagal nerve can be affected. Now, here's the interesting piece of it. That vagus nerve goes to the heart and it attaches itself to two nodes called the SA nodes, the sinoatrial nodes. That allows your heart to beat properly. And if that nerve isn't firing properly, or if it's not contacting or sending signals properly, guess what happens? You end up, you can end up with heart failure. You can end up with irregular heartbeats. But remember I said it also goes to the lung? It can cause you not to breathe well. It can cause the lungs not to expand properly. And subsequently, your automatic breathing regulatory system is being compromised. So a lot of that can come from there. And then you have the glossopharyngeal nerve. That's a nerve that goes to the back of your throat, and the hypoglossus as well. It goes for the back of that area, the back portion of the tongue and the throat area. So if your signaling is off because we have a misalignment of the upper portion of the spine, the skull, which we call the occiput, or the first and second vertebrae, C1, C2, we call them atlas, see the first one, and axis, the one that pivots around the second one, you can have an interruption of the signaling to those targets, and subsequently we got a problem, right? Not a good thing to have. So we have, a malfunction in the central nervous system, and it causes that signal not to do what it's supposed to be doing. So we have to know and be able to distinguish which is which, but we end up with risks. And this is the piece that I want you to know. If these things aren't communicating, you may not have a severe presentation relative to nighttime interruption because you don't even notice it. You're just kind of waking up a little tired. You may not have the rest of the things, but your risk of heart attack and stroke and diabetes, anxiety and depression, we talked about high blood pressure, the gastric reflux, kind of up chucking all the time and burning your esophagus, your food tube, weakness, body pain, fibromyalgia, and then we talked about the heart. All of those things can come about as a result of sleep apneic conditions. Not a good thing, my friend. So what we need to know is how do we diagnose it, for sure, and what can we do about it? I'm here at 888-630-9625. That's 888-630-9625. You're listening to Dr. Tom Roselle Live. I'd love to talk to you on this subject or anything else. I've got a lot of good information for you today. Want to make sure that you get the data and you're able to use it, process it, know where to go to get it fixed. That's the most important piece. We have problems that we kind of put up with or we dumb down with all kinds of things. In this case, breathing apparatuses, that our doctor says, well, the only way that you're going to be able to fix this is we've got to put you on whatever. And they put you on a device that supposedly, will force oxygen into your body. I think there's other ways of making this handled properly. If this is a structural problem and as a result of trauma, if a result of injury, conservative diagnosis of where it's coming from and conservative treatment to turn the system back on to do what it was meant to do originally is really where we need to go, right? And, there's some good people out there, and starting, with the Roselle Center in Fairfax, the doctors there are amazing in their ability to go through and handle these types of things. Going out into the burbs up in the Broadlands, Core Concepts Chiropractic by Roselle out in Broadland, Ashburn area. They all are very well attuned to finding and fixing these things. But let's talk about how a sleep apnea condition is not only treated, but how do we find it to begin with? How's it diagnosed? Those are the most important pieces. So obviously you can do a sleep study. So you go into this crazy place and they hook you up with all kinds of stuff. You ever tried sleeping with all these wires hooked up to you? Have you ever tried getting a good night's sleep when everybody's monitoring you? I don't know about you, but I'm going to wake up 1,000 times anyway. I don't think that's probably the best bellwether to finding this type of situation. But there's some home units that you can do. One of our supporters, Dr. Michael Chung, has a unit that you can take home, hook up, and it will monitor you in your own bed. You can get a good idea of how that works. But more importantly, you can do it through testing muscle function. And because if you have any of the symptoms that we've already talked about, you're waking up with that headache, you're tired, you never seem to get enough sleep, your spouse, your partner's throwing things at you in the middle of the night or leaving the room and going to sleep on the sofa or a spare bedroom, you probably have a problem. And, if you got that weight around your belly and you haven't been able to take it off, that's another suggestion, another indicator that you probably are dealing with something that is not usual. You're not getting that really good night's sleep. And then some of you notice that if you sleep in an upward position a little bit more, that you feel a little bit better. But sleeping in that position with your thoracic area, your head elevated all the time, is not good either, because that produces other structural and neurological inconveniences and breathing patterns, because then that whole breathing mechanism is altered and your muscles tighten down and you can't stretch and you end up with other kinds of pain. So when we look at sleep apnea conditions, we have to know how is it there to begin with, meaning we have to deal with those things. We're going to talk a little bit more about that. We're coming up to a break and we're going to touch upon this, but I want to tell you what to do about it because it's truly important. You're listening to Dr. Tom Roselle Live. I got way too much information for you today. Don't go away. I'll be right back after these important messages.
Happy to be back on WMAL. Join me, Dan Bongino, weekdays at noon beginning May 24th.
Welcome back, everybody. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live. Indeed, I am today. Love to talk to you. Give me a call at 888-630-9625, 630-9625. Anything that's on your mind, we'll kind of pick it apart and do what we need to do with it and point you in the right direction. And if there's anything that you need to know further, you can always get a hold of me at rosellecare.com and just go contact, and it'll give you my personal email. It's real simple, and I will get back to you. If you'd like to talk to one of the doctors, simply call 703-698-7117 and tell them what the issue is and tell them to have somebody call you, and that'll happen as well. No problem whatsoever. We're again here at 888-630-9625, talking a little bit about sleep apnea conditions, and we kind of ran out of time for some of the things I wanted to tell you about. So the important thing is that, you know, we want to be able to handle something that is fully able to be dealt with. And we said that the back of the throat closes off, and we have two types of sleep apnea conditions. One is central, the other one's obstructive. Obstructive seems to be, from the dental profession, the medical profession, the one that is the most common. The central, which means that it has to do with neurological input from the brain and its neurological input. In their opinion, not as much, but in our opinion, that off-centering of the upper portion of the neck and occiput. We see a lot of sleep apnea conditions in people who have had structural aberrations over a period of time. They've had accidents. They've had whiplash type of injuries. They sleep on their stomach. They're bent over a desk all day long with their head tilted down, forcing their neck curvature in the wrong position. So subsequently, what we have to do is we have to handle that. Now, we work cooperatively with dental professionals, and particularly Dr. Chung, to put a device in, if necessary, to bring the jaw forward just a little bit. And what that does is it mechanically opens up the back of the throat, but combined with good structural evaluation and upper cervical manual manipulation, we've had amazing results. And, you know, nobody's going to tell you 100%, but in our experience, it's way up there, and we can get these things resolved. And all of a sudden, those conditions of not feeling good, the inability to concentrate, the blood pressure problems, the overweight situation, all those things begin to go away. And that's really what we want to get done. That's the design. Those are the things that we want to make happen. Anything short of that, you know, what you're doing is in my opinion, you're causing other issues to occur. And it's not okay. We want to make sure that, you know, you have the opportunity to fix something and get it back to normal. The body's amazing in its capacity to resolve virtually anything. And if you remember that and you begin to shift things and change things as nature meant them to be, all of a sudden you get your life back. And that's what we often do, and our experience has been one that we're able to do that on a regular basis. I want to bring you a little bit of data. I don't know how many of you were paying attention to the news, but there was an article that was released and a commentary that was brought about on the vaccines that are out there, these COVID-19 vaccines. And they were saying that they're starting to notice, and they put it, well, not often, but the fact that it hit the news, I'll let you think of how often it is, that we're starting to see some heart problems, some residual problems with cardiac function, inflammatory reactions. It's called a pericarditis or a myocarditis. And that means, myocarditis means this is an inflammation of the heart muscle. And a pericarditis is the surrounding area, usually has to do with the wrapper around the heart. So just be aware that there are certain things that are starting to show up on the radars, things that we've told you about in the past that you have to be very careful about. And, you know, we can talk about unintended consequences, right, of these mRNA vaccines. Well, just remember, there's a great book out there. It's called The Truth About COVID-19. It was written by Dr. Joseph Mercola. A lot of respect for that man. He's put his own reputation and his person in jeopardy by coming out and saying some of the things that he has. So you want to check that book out. It was immediately overbought and oversold, but it's back on the marketplace. And it's simply called The Truth About COVID-19, and you can order it online from Amazon. It's there. So do the best you can to inform yourself and make sure that you get all the data that you possibly can. I was listening to Tucker Carlson, and he printed a blog and talked about how many people that have died from the COVID vaccine. And he said, why should you ask that simple question? How many Americans have died after taking COVID vaccine? It places you in a high risk of censorship. And I've already had people come after me because of the things that I've told you. But, you need to know. And again, I'm reporting something that he published and as recently as May 22nd. So do your homework. And I'm only giving you little bits of data that you need to follow through, and tell me if I'm wrong, but I encourage you to do your own research. We're coming up to a break. You're listening to Dr. Tom Roselle Live. I got a whole lot more for you coming up in the second half of the program. Stay tuned. Don't go away. Stay with me. I'll be right back.
Dr. Tom Roselle Live continues now on 105.9 FM, WMAL.
Welcome back, everybody. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. Indeed, I am. It's another lovely day in the neighborhood. Make sure you get outside and enjoy it. It's really very pretty. I'm going to do that immediately after the program is done. If you leave beforehand, make sure you take me with you. Plug me into your ears and walk around and listen to what we have to say. Got a lot of stuff to share with you today. And, we talked a little bit about sleep apnea conditions and what happens as a result of, in our experience, misalignment of the upper portion of the neck and occiput and neurological transmission, how the nerves of the brain, particularly the vagus, the hypoglossus, glossopharyngeal nerve affect that. And we said there was two types, right? We said there's a little central sleep apnea condition and there's an obstructive condition, and all of which, fortunately, we find in our experience can be modified. So if you are kind of at a loss, you want to get off that crazy breathing machine that you're on all night long and, see if you can do something better, well, give us a call. We'll be more than happy to evaluate you. The doctors at the Results Center are really up to speed on this kind of thing, and they know their deal. Don't forget to look at Dr. Joe Mercola's book, The Truth About COVID, and I think you'll be very happy that you purchased it. It's not expensive, but it's going to open up your bandwidth and make sure that you have the capacity to really understand what's coming down the pike here. He's put his personal and professional reputation at risk, and he's been attacked many different ways, and we've had people kind of ding us as well. But as long as we have a microphone, we're going to try to continue to give you the information that you deserve relative to any issue that's out there. I want to talk a little bit about something that we've seen continually over a period of years, and we're talking about the impact of blood sugar regulation on pain and spinal dysfunction and disabilities and so forth. But in between, we'll answer any questions that you have. Call us right now here at 888-630-9625. That's 888-630-9625. So, in all the years I've been in practice, which, we've finished 44 years of practice, moving into the 45th, and I'm in a position now that I'm the oversight guy. I get to make sure that we have quality control going on an ongoing basis. What I've noticed is, and we're going to quote and send you to some articles, is that people who have blood sugar handling problems that end up with a higher problem of neuromuscular dysfunction, and particularly those who are in pre-diabetic conditions or full-blown type 2 diabetes, the underlying mechanisms that are significant relative to what goes on with the muscular system and how it affects the nervous system, brain function, and so forth. Diabetic patients, period, straight out, have a higher risk of developing physical disabilities than non-diabetic patients. End of story. They simply do. All the data will show you that. There's a lot of very well-researched articles. Physical disabilities appear to also be related to that situation, at least in part to what happens with muscular dysfunction. So if you have, if you're diabetic, if you're in a pre-diabetic state, or if you're in this condition what we call hyperglycemic reactivity. That means your blood sugars bounce up and down. Yeah, they can do that, right? One day they can be really high. One day they're around your toenails. And, we probably should do a whole program on this. But nevertheless, we're going to touch on the basis, things I want you to understand. There are several studies have reported reduced muscular strength and power under dynamic and static conditions, so movement and then isolated conditions. in both the upper and lower extremities, limbs of patients, with pre-diabetic and type 2 diabetic situations. So it includes, a reduction in the size of the muscle. People can't put muscle on anymore. They can't build muscle. They don't have any strength. They find difficulty going up and down steps. There's no power available to them anymore. So the impact of diabetes on neuromuscular dysfunction, has long-term consequences. And we have to make sure that we're aware of it. Peripheral neuropathy, that numbness, that tingling. You've heard the ads about it feels like a sock balled up in your foot. You have tingling in your feet, and it's always there. It doesn't go away. It burns, it aches, and so forth. That peripheral neuropathic pattern has shown to affect muscles by impairing motor nerve conduction and also blood supply complications along the line as well. All these things, if they're identified properly, can be treated. If you wait too long when there's permanent neurological damage, you got a problem. But here's the relationship, and this is what I want you to understand about this. When you're dealing with a diabetic pattern, you have this inflammatory reaction that's going on. You have the inability to transport blood sugar into the cells, into the mitochondria, which are the little engines of the cells that control muscle function and energy. So you're not getting in, but now it causes an external inflammatory reaction that causes the nerve and the muscle to begin to break down. So there's a huge growing body of evidence, that indicates that hyperglycemia or increased blood sugar may cause alteration in the fibers of the muscles that generate your power, your force. And it happens because of multiple mechanisms, not just one. But the good news is that if you identify these things and you see exactly what it is, you can fix them. However, here's where it comes, guys. You got to take responsibility for changing the fuel that goes into your system, the dietary patterns. We're living in this sad world, and when I'm talking about sad, I'm talking standard American diet. The crap that we put in our body, all the fast-acting carbohydrates, all the sugars, all the garbage. And we wonder why we have these pre-diabetic conditions that are starting, and we're looking for a magic drug that's going to put the fire out. The problem is the magic drug is the thing that we put into our mouth, but in our situation, we want to talk about food and making sure that there's the right fuel, if you will, that goes in that resolve this. So you can get all kinds of treatment. You can take, metformin. You can take all kinds of other diabetic medications. You can go get structural care. But if you don't combine the two, if you don't change the fuel, if you don't get a little bit of exercise by just gently walking, if you don't push yourself away from a stagnant, sad diet, then you're going to suffer the consequences of this diabetic neuromuscular impairment that we're beginning to see. And it happens in pre-diabetic states, not just full-blown diabetes. And this is the thing that I want to draw to your attention. You must understand that you are responsible for many of the things that take place. Yes, we can treat the neuropathic pain, that comes as a result of diabetic neuropathies. We can treat the neurological pain that comes from structural neuropathic problems. What I mean by that is if your low back, for example, is degenerative, if you have a narrowing of the spine, it's called spinal stenosis. That's entrapping, compressing, putting pressure on the nerves that go to your legs and your feet, causing that numbness, that tingling, that sock effect. Well, you got to do a couple things. The nerves are being affected. Now there's an inflammatory reaction that takes place, but you've got a spinal system that is being broken down, and that has to be treated if you want long-term resolution from any of these things. The more that you understand the mechanisms of production, the things that are actually causing this, and realizing that in the greatest majority of cases, these are do-it-yourself conditions, meaning that you've had your finger in the pot and you've been stirring it up now for quite some time. And unless you change something, you're going to continue producing the same thing that you've been producing. And this condition, what we're talking about, is neuromuscular dysfunction, weakness, inability of the muscles to have any strength. And you can't put muscle on, or you're going to get tingling and numbness, that neuropathic pain. All of those things can be reversed, providing that you are willing to say, oh, I did have my finger in that mechanism now for how many years? And we have to make sure that we begin to turn them around. There's a journal that I read often. It's called the Journal of Manipulative and Physiological Therapeutics. It's produced by the National University of Health Sciences out in the greater Chicago area. And it's a journal that on an ongoing basis will do and publish research articles on exactly what we're talking about. And they do it from, a lot of different positions, but it's a lot of, for you, maybe a lot of gobbledygook. For you, have a little, those of you who have a little medical background, you may be interested in picking it up and reading it. And it reveals exactly what we've been talking about on this diabetic situation. You want to make sure that you're aware that you can reverse this stuff, and that's the most important thing. Reversing any of these conditions has to do with understanding why it comes about. There was an article that was written in the Journal of Applied Physiology, and they talked about weakness and endurance in muscular patterns in diabetic and pre-diabetic patients, and those that had neuropathy and those who did not have neuropathy. So those who had numbness and tingling and those who didn't have numbness and tingling. So you don't have to have the numbness to have weakness. And, they talked about how the muscles begin to become very easily fatigable. They break down very quickly. Like you get up and you walk 100 feet and all of a sudden you're tired. The fatigue induced by physical and even mental exertion, interestingly enough, was recorded with people who had blood sugar handling situations. Why would the two go hand in hand? Well, here's the other piece. Blood sugar supplies the energy for your brain, right? And so if you got too much of it, it's just as bad as not enough of it. So your brain needs glucose. It needs sugar. But if you give it too much, it overwhelms it and it begins to deteriorate. It breaks down the tissue. So now you can't. And when you start thinking or reading or processing, that becomes a fatigue process to the brain, as well as it does process to the muscular components of the body. And here's the one that we haven't talked about yet because simply time isn't allowing it. We can get into it very deeply, is the heart as well, because the heart needs to have adequate amounts of energy supplied to it and the right amounts of glucose, transporting and feeding the mitochondria, the two highest levels, these little engines. When we talk about mitochondria, we're talking about little engines, the little engine that they're very concentrated in the brain, the heart, and muscle tissue. But if you overwhelm them with too much and the wrong forms of energy, and the overwhelm can cause all of them to begin to break down. But there's article after article after article about what happens, with this pre-diabetic situation. They studied it with type 1 diabetes as well, but, we used to call type 2 diabetes adult onset diabetes, but unfortunately now it's just gone to straight old, type 2 diabetes because it's no longer adult onset because kids are coming down with it. And we've got a society of kids being too fat, too big, and it's causing tremendous amount of consequences to their body. And we're seeing kids that can't function. Their muscular patterns are breaking down. They don't have the strength. So all of this is there and is available for your research. All you have to do is go and, diabetes and neuromuscular dysfunction and so forth. But remember something, that this can be reversed. And you can improve the neuropathic pain, but you have to isolate where it's coming from and what the sequela, the consequences are of where you are right now, and the ones that are going to show up if you don't do something with it. So in the form of low back pain, if you have low back pain, and it's caused the nerves to break down, and you couple that with diabetes and blood sugar handling problems, you have to treat both. No getting away from it. You got to treat both. We're coming up to a break. So much I'd love to share with you. We'll be right back after some very important messages. You're listening to Dr. Tom Roselle Live. Don't go away.
Washington's Mall, 105.9 FM, WMAL.
Welcome back, everybody. You've been listening to Dr. Tom Roselle Live, as you do every Sunday at 11 a.m. on the Eastern Seaboard. We're here for you, and we're bringing you the most intimate and on point and updated information on healthcare and all the controversial areas that we can possibly do. Remember, we do it simply for one reason. You deserve it, and we want to make sure that you have all the data to make the decisions that you can. Talked about a couple things today that are very fixable. One is neuromuscular weakness, the weakness of your muscles, your inability, your fatigue patterns, your inability to do things, get your butt out of the chair because it's just too tiring to walk across the room, chronic pain. And we're talking about the end ramifications of what happens with diabetes. People who have diabetes are more likely to have spinal pain than anybody else. People who are pre-diabetic have a greater tendency towards spinal pain and muscular pain than anybody else. And now you got a double catch, right? You got the neurological implications of what's going on, and now you have the biochemical issues. They both have to be treated. The doctors at the Roselle Center can help you with that, and also at Core Concepts out in the Broadlands. Now, we talked about sleep apnea, we talked about headaches, we talked about lack of fatigue, we talked about, the inability to function and weight gain, particularly around central area, hormonal dysfunction, and it goes on. It can affect your heart, it can affect your lungs. All of these things, if the why is realized and identified, can be treated. So you have to look at neurologically. You just don't settle for it. Take this, hook up to the machine for the rest of your life. This is what you have to do. There's another level, and there's a lot of data surrounding it and studies that have been done. There is no one approach, but when you combine approaches, when you put things together in the right thing and you change lifestyles, all of a sudden you see things turn around. And that's what we want you to understand. Health is in your hands. I wrote a book. It's called, Ageless Health. Health is a do-it-yourself program. And by the way, we want you to know that the Roselle Center for Healing, which is part of multidisciplinary alternative care centers, is also parallelly supportive what we call Ageless Health Regenerative Medicine. And these are people who do stem cell and regenerative medicine protocols and so forth. And what we'd like you to do, if you have any interest, all you need to do is call the Roselle Center, and they'll hook you up to the people that can talk to you about that as well. So our bandwidth is expanding. We're doing a whole lot more. But by the way, my book, Ageless Health, Health is a Do-It-Yourself program, is still available. You can call the Roselle Center. You can go online. I think it's still there. And we're in the process of expanding that. And hopefully by the end of the year or in 2022, you'll have another version that will be expansive. But this one is extraordinary. I want you to have it. Make sure you reach out, get it. It's a guide. It tells you how you put together the structural, chemical, emotional platforms to serve yourself, because you deserve it. You need to know. That's why we continue to do the program and give you all the information that we can. But remember, with the two conditions that we talked about today, you can reverse virtually anything that is coming down the pike if you really understand the why. You look at, what you're putting in your system. You get away from that standard American diet. You start getting a little exercise. You take care and quit putting up with the structural pain that you're dealing with, that numbness, that tingling that might be in your lower back, or the loss of sensation. You've lost the ability to have a solid gait anymore. That's not normal. That's not normal, and it's something that can be totally reversed. We're here every Sunday, my friends, bringing you all the data that I can possibly give you, and we're here if you need to talk to me. Go to rosellecare.com and send me a note. And I continue to do this, and only for one reason and one reason only. I love you all. See you next week. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.